Factitious disorder, also known as Munchausen Syndrome, named after a German cavalry officer, Baron Munchausen. He was known to embellish and fabricate his life stories and experiences. The exact prevalence of the disorder is currently unknown, but it has been estimated between 0.6 and 3% of referrals from general medicine to psychiatry are made. So what actually is Munchausen syndrome and how does it affect an individual? While an individual may make up and exaggerate symptoms in order to garner sympathy or seek medical attention, the individual does not do this for any external reward such as financial gain, time off work, or certain prescription medication. This is known as malingering. Munchausen syndrome can be very hard to diagnose, as the individual are often well versed in terms of the types of symptoms they present with, and so make it very plausible that they have that particular illness. The extent the person is willing to go to in order to pretend to be ill really does vary, from falsifying lab results to taking certain drugs or medication to make themselves ill. Faking an illness is not only potentially harmful to the person, but also it is very costly in terms of treatment and clinician time. Often once extensive investigation is done and comes back inconclusive, the person would create new ones to continue the cycle. Another similar disorder, previously known as Munchausen Syndrome by proxy, now known as Factitious disorder imposed on another. Similar to how Munchausen syndrome works, however, the person now inflicts this fabricated illness onto another, usually the person's child or someone they are caring for. As the person is now imposing an illness onto a vulnerable person, such as a child or a person in need of care, this could lead to dangerous circumstances, especially if the person receives unnecessary medical attention. Looking at a case study of a mother who called an ambulance for her 6-year-old son, stating he had been unwell for a number of days and that his health is decreasing despite giving antibiotics and pain relief. The child was admitted to hospital and put on a glucose drip due to low blood sugar levels. Once the drip was removed, his blood sugar levels had plummeted down again. This happened a number of times whenever the IV glucose was stopped. Upon changing the IV drip on one occasion, the clinician noticed the tubing had been tampered with. What looked like a small piercing, suspicion was raised. Another IV bag was put in place. However, this time the bag did not contain any dextrose, which the mother was unaware of. Subsequently, the child's blood sugar levels remained normal, despite the fact that the IV bag did not contain any dextrose. This created further suspicion. The mother was eventually removed from the room and the child's blood sugar levels had remained stable. Further investigation had shown high insulin blood levels, and so it was found out that the mother had been injecting insulin in the child's drip to keep his blood sugar levels down. The child was removed from the mother's custody and made a full recovery. Munchausen syndrome by proxy is a serious and potentially life-threatening situation for the victim involved, and the mortality rate approaching 10%. The only available treatment for both types of disorders is psychotherapy, which is often unsuccessful as the person does not accept the diagnosis and are adamant that they are in fact ill, or the other person in their care has an illness. That being said, with Munchausen syndrome by proxy, it is imperative that the victim is removed from the perpetrator's care, and may also need therapy as they recover. Thanks for watching. Don't forget to like, comment, and subscribe.